Hi, can you hear me? Good morning, everyone. Good morning, everyone. How are you doing? Can you hear me? Let me know if you can hear me. Okay. Right. Oh, my soul, worship you so.
Restart, reset.
Never before. Oh, my soul. Welcome, everyone. Welcome. Today is Thursday, the 20th. Okay. The 20th of August, Thursday. Let's wait for others to join, okay? Welcome, everyone. Welcome, Sarah. Welcome, Justice. Welcome, Sarah. So now we have two Sarahs. Sarah Idris and Sarah Nkanza. Jennifer, welcome. Good morning. Josephine, good morning. Emia Seti, welcome. Good morning. Good morning, Teresa. Good morning, Ado Victoria. Good morning, good morning, good morning, good morning, everyone. Good morning, everyone. Good morning, good morning, good morning, everyone. Good morning, Brazil. You are welcome. Jane, good morning. Good morning. So today we are here to test our knowledge and our strength on cardiovascular emergencies. Okay. Yeah. Good morning, Ado Victoria. Good morning, everyone. Good morning. Good morning. Good morning. Good morning. Good morning. Good morning. If you have not liked and shared the page, like this page, share, subscribe to others. Subscribe and share. Subscribe and share for others to join. Okay. Good morning. We are starting in the next 1 minute. We are starting in the next 1 minute. So position yourself, like and share for others to join. Share if you have not subscribed. Yes, we are more than 40 online. I want the likes. I want to click on the like today's session. Click on it. The like, click on it. And let's start. Good. Good morning. Good morning. Good morning. Good morning. Good morning. Aaron Valerie. Okay. Good morning, everyone. Good morning. Click on today's session. Like, click on the like, click on the like, click on the like. Good morning. Yes, we are waiting for others to join, then we start. Okay. Right. Thank you so much. Good morning. Good morning. It's another beautiful day the Lord has given to us. It's another blessed day. Okay. Yeah. It's another beautiful day the Lord has given to us. Good morning. Yeah. Good morning. 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 Let me bring the good morning. Like and share. Yes. Like today's page. Like today's session. Like it. Okay. Yes. Like today's session. Like. Okay. Oh, Ellen, I'm good. And you? Right. So let me share the screen and let's start as soon as possible. Okay. Right. Good. Right. So we start. Okay, so we did cardiovascular emergencies yesterday. Okay, so everybody knows how to manage cardiovascular emergencies. So today we are coming to test our knowledge on that. We are coming to test our knowledge on that. Okay, cardiovascular emergencies. Right. So the first question: a 68-year-old patient arrives with substernal pressure, diaphoresis, and nausea that began 35 minutes ago. The initial ECG shows ST segment elevation. The first high sensitive troponin, that's troponin O, is within the range, the reference range or normal range. Which nursing action is most appropriate? Question number one. Shoot your answers. Let's go. Shoot your answers. Shoot your answers. Yes. Understand the question. Everybody should try. We are more than 40 on the page, please. Everyone should try. I want to see you type your answer. Try your hands. Try your hands, please. Please. Don't only come here and observe. That is why we are learning together. So try your hands. Try your hands. Yes. I want to see everybody type. We are more than 40 online. So I want to see everybody type. Okay. It should not be a job for only some few people. No. You were part of class yesterday. So you should be able to manage. Okay. This is a case. The patient is having substernal pressure, diaphoresis, and nausea that began 35 minutes ago. The initial EKG shows or ECG shows no ST segment elevation. The first high sensitive troponin or troponin O, the troponin 0 minute, is within the reference range. Yes. Good. 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 I want to see answers. Right. So this patient is having no ST segment elevation and troponin O2 is normal. Okay. So you won't say because of that you are discharging the patient home. Okay. So you repeat the EKG and the troponin again. Okay, according to the STEMI protocol, before you can discharge the patient home. So B, those of you who chose B, okay, You had it right. Okay. Now let's go to question 2. A patient with chest pressure has a blood pressure of 148/86. Before administering sublingual nitroglycerin, which statement requires the nurse's immediate intervention? Which statement requires the nurse's immediate intervention? So blood pressure is 148/86. Patient has what? Chest pressure. Okay, before administering NTG. Question number 2, shoot. So you write your question, then the answer beside it. I want everybody to answer. Everyone. Question number 2. Question number 2. Then you write the answer beside it. Yes. Yes. Question number 2. Give me answers. Okay, Victoria says cannot see the question. Is it that it's too small? Is it better now? Auntie Vic. Is it better for you now, Vic? Yes, everyone should choose the answer. Yes, I like easy questions like this would challenge you to go back and learn. So, right, Victoria, let me know your response if you are good. If you can see well, add to Victoria. Good. I gave you a simple formula to answer question number 2 yesterday. So those of you who went back to their notes, they should be able to get that answer. Okay. So I told you we have the AST formula. Okay. Right. I told you we have the AST. So adanafil, sildenafil, and tadalafil. And I told you every nurse, I work 12 hours a shift. Okay. If I take overtime 2 days, it will be 24 hours. And if I multiply this by 2, I'll get 48 hours. Okay, good. So I told you that if you get this potency, if a patient says I'm taking potency or impotent, like sexual dysfunction and all those stuffs, medications, you have to ask for the name of the medication the patient is taking. And if the patient mentions it, the first letter, okay, the first letter. So this is the name of a medication called adanafil, sildenafil, and tadalafil. Okay, yes. So if the name is A, it means that you can give nitroglycerin after 12 hours, but not before 12 hours after the person has taken A. Sildenafil, you can give nitroglycerin sublingual if patient has taken sildenafil after 24 hours, not before 24. Okay, so those of you who were choosing B, shine your eyes. Then tadalafil is 48 hours. So if we give you these medications, okay, Question says, patient has chest pressure, blood pressure 148/86. Before giving nitroglycerin, which statement requires the nurse's immediate intervention? Meaning patient has made a wrong statement. Okay. So the patient said, I took tadalafil approximately 30 hours ago. So it means that it has crossed this, but it's still within this range. So this patient can take adalafil and can take sildenafil, okay? But for tadalafil, because if he has taken tadalafil, then it means you can't give the nitroglycerin because it's not up to the 48 hours, okay? Then there's B said, I took sildenafil approximately 30 hours ago. Sildenafil, you can take sildenafil and after 24 hours, you can give the patient nitroglycerin. So those of you who chose B, okay, yes. So question 2 is A. Okay, thank you. Question number 3. A patient reports sudden, severe chest pain radiating between the scapulae. Okay. The right arm blood pressure is 182/96 millimeter of mercury, and the left arm blood pressure is 148/82. Which prescription should the nurse question? Shoot. Question number 3. Question number 3. Shoot your answers. Let's go. We mentioned this yesterday. Shoot your answers. Yes. I need more answers, please. Even if you are wrong, I want you to choose the wrong answer now so that you get the explanation before choosing going to take any answer before than being quiet and you in the exam room you will miss. Okay. Yes. Don't be afraid of anyone. Don't let anybody's answer confuse you. Choose the right answer. Okay. Yes. Choose the right answer. Yes. Get the right answer, guys. Yes. Question number 3, more answers. Severe chest pain radiating between the scapulae. The right arm blood pressure is 182, right arm. The left arm is what? 148. Okay. Which prescription should the nurse question the doctor? Doctor, we beg you. Okay. The doctor will make orders. It is called prescription orders. Okay. Yes. Sudden severe chest pain. It's sudden severe chest pain. Okay. Good. Right. Okay. Let me see. Right. So Okay, question number 3. Good. Good. Yes, so let me address those who chose the wrong answers first. Some people chose C. Okay, some people chose C. Yes, so this, looking at this cues, okay, identifying cues, okay, these cues suggest aortic dissection. So in aortic dissection, the right and the left, when you do your blood pressure, it will never be equal. Okay, so the question showed us here that the right blood pressure was 182 and the left was 148 as the biggest clue. A sudden severe chest pain radiating between the scapula. Okay, yes. So let's take it one by one. It is good to initiate what continuous cardiac monitoring. It is also good to establish 2 large bore IVs. That is very important. Then C, administering of IV beta blocker as prescribed. You question the doctor because these 2 blood pressures, okay, if you give beta blocker, it is going to reduce this blood pressure further down. Okay, so it is not advisable. Then sorry, it's advisable. Then it's advisable. Yes, it's advisable. You can be, because even though this one will go down, but this one is our concern. So if it goes down, cool. But the D, IV fibrinolytic immediately. Okay, fibrinolytic, heparin, fibrin. I told you heparin works on what? The fibrins. Okay, yes. So already this patient is having aortic dissection. He's having bleeding issues. So why do you still have to give a medication that will make them still bleed? That is why we need to go to the doctor and question the doctor. Okay, good. So those of you who chose D, they were right. Okay, question number 4. Question number 4. A patient presents with severe chest pain, diaphoresis, ST elevation on lead 2, 3, and AVF. Blood pressure is 82/54 mmHg. Lungs are clear and jugular veins are distended. Which prescription should the nurse clarify first? Question number 4, shoot. I hope these questions are cheap or good. These are cheap questions. Now, I trust you guys. Okay. Lead 2, lead 3, and AVF. Lead 2, lead 3, and AVF. Question number 4. Oh, really, Sarah? Today is cocoa. This one is very cocoa porridge. You can easily drink it. When you were in primary school, say, these questions are cocoa. They're like porridge. You can easily drink. You don't have to chew it. Yes. Question number 4. Question number 4. A patient presents with chest pain, diaphoresis, ST elevation in lead 2, 3, and AVF. Blood pressure is 82/54. Okay. Chest pain, diaphoresis. These two answers, these two clues show ST elevation in lead 2, 3, and 4. Okay. So lead 1, lead 2. Okay. Lead 3. See, then AVF, AVR, AVL, AVF. So all the three down here. Okay, good. Blood pressure is 82/54. Lungs are clear. And jugular veins are hot, distended. Okay, good. Thank you, Joan. Yes, that is, we are all boys, girls. So, we did EKG, so you should know how to diagnose this. You at least 2, 3, and AVF. Go back to your EKG slides. They are all there. Don't throw away your slides. Okay. Okay. So, if you want to use the ABCD algorithm to answer this question, to treat these patients, okay, A is definitely airway. Is there any airway intervention here which needs to be done? Obtain this rapid, blah, blah, blah. Okay. B, breathing. Is there any breathing intervention here? There are so many tricks to answer in class. Breathing intervention here, blah, 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 blah. Okay. Cardiovascular. C, circulation. Obtain right-sided EKG leads. Okay, cool. Everybody will do it. Administer rapid crystalloids. Okay. Should the next clarify first? Okay. C, administer sublingual nitroglycerin. And D, activate the cardiac catheterization team. Okay. So let me see the answers you people submitted. Okay. So in cases like this, if you administer this sublingual nitroglycerin, in this case, in this condition, ongoing, this case, okay, with this blood pressure, if you go and give this medication, this is a potent vasodilator, okay, a potent vasodilator, especially venous. The venous vasodilator. You remember when we were doing cardiovascular some time ago? So we have two types of vasodilators, the arterial vasodilator and a venous vasodilator. Okay. Yes, so this is a venous vasodilator. Okay. So it will open up the veins, what are the two bigger veins in the body? The inferior vena cava and the superior vena cava. If you go and open it, it will struggle to push blood to the heart. So sending blood back to the heart in physiology, we call it preload. So if you give nitroglycerin and you decrease the preload, this blood pressure, cardiac output will be in big trouble. So will you give this medication in this scenario? No. So if the nurse is very good and they know their physiology, then they will question the C. So those of you who chose C, okay, yes. Definitely you activate the cath lab, the cardiac catheterization team, okay, for PCIs and all those types. because this is what inferior MI, inferior lease. Okay, good. Question 5. The emergency nurse receives report on 4 patients. This is the question I like. Which patient should be assessed first? Shoot. ED nurse, 4 patients. Don't worry, let them bring 1,000. We are ready for them. Eh, Answer the questions on this page, okay? Answer the questions on the page. Answer it on the page. Caleb. Question 5. I trust you. See, this question, you should not spend less than 30 seconds. You should kill it. Know you as a friend. I have me. Which patient? Somebody is asking, please answer for question 5. We are now solving it too. We've not answered it yet. We are now solving it. Okay. Question 5. Everyone should answer, please. Everyone should send them. Don't be a spectator. I want you to answer the question. Okay. 4 patients, which one should be assessed? Shall, when English use shall, the word shall is a compulsory verb. Whether you like it or not, it must be done. When you see shall in the questions, it's a compulsory verb. I told you English, they use grammar sometimes. Okay. Okay. Good. So let's solve it. Okay. Let's solve it. This my thingy. Okay, I'll take it away. So I told you that when you get, sorry, let me mark it. Okay. When you get questions like this, group them into twos. So in the English room, they will give you pen and paper. Don't worry, write it. Pen and a card. Write it. Question A and B. Answer A and B. Then C and D. Make it like this. And analyze it in twos. Okay. Analyze it in twos. Okay. So let's start from A and B. That's the trick to analyze this type of priority questions. So A and B. A patient with chronic heart failure, bilateral ankle edema, okay, and oxygen saturation of 94 degrees percentage, okay. Then B, a patient with atrial fibrillation, a heart rate of 138, and a blood pressure of 124 mmHg. Okay. This patient has chronic, okay, so I generated a certain acronym. We call it the AMASA. The AMASA. AMASA. Okay. AMASA is ABC. Either you use the ABCD algorithm. or the Maslow's, okay, Maslow, or write it down, or acute. You see an answer with acute or chronic. Acute will be prioritized over chronic. We have patient with stable or unstable, and actual or a potential. Okay, potential. How will you know that an answer is an actual problem? They will use the word wait. So this, okay, when you see this English, wait, 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 wait. I told you NCLEX is about grammar. Okay, they use grammar to hide the answers, the clues. So shine your eyes. Okay, let's take it one by one. A and B. This patient, a patient with chronic heart failure, a patient with chronic heart failure, bilateral ankle edema, and oxygen saturation of 94%. So this patient has what? A chronic heart failure. Which system are we looking at? The C, the cardiovascular. He has a cardiovascular problem. Okay. Bilateral ankle edema and oxygen saturation of 94. Then you ask yourself that, is there any problem with this guy? Yes. He has a problem because of the weight. This guy has an actual problem. He has an actual problem. A. So this guy has an actual problem. Let's go to the B. A patient with atrial fibrillation, the same cardiovascular system. Okay, the same. This has a cardiovascular system. This has a cardiovascular system problem. But this one has a, because this one has a weight here. This one has a weight here. So both of them have what? Actual problems. But this one has a chronic. Okay, they have used the word chronic. And this one has what? Atrial fibrillation. Every atrial fibrillation, they did not qualify it as a chronic. So it means what? This is what? An acute problem. Okay. So this B has, if you take this A, the AMASA, acute or chronic. So this one has chronic, this one has an acute problem. Yes. So let us rate them. Both of them are cardiovascular problems. Both of them are having actual problems. Okay. Both of them, A and B. But this one has what? The A has a chronic condition, but this one has an acute. So I will definitely prioritize. With these three clues, I'll prioritize the B over the A. So when I see this, I won't waste time. I will cancel the A. Then I jump and go to the C and D. The C says a patient with what? Sudden tearing chest pain. Sudden tearing chest pain. Okay. New ankle left, whatever, weakness, and unilateral radial pulses. Okay. So let's use the AMASA to rate it. A patient with sudden tearing chest pain, he's having cardiorespiratory problem. Okay, so this guy will have an A problem. The AMASA, he has an A problem. I think I don't know how best I can get. If I got this, like I'll illustrate it. He has an AMASA problem, the A problem. Okay, they have used weight. So the weight says it is an actual problem. They are not joking with it. It's an actual problem. It's not a potential. Okay. If they use the word at risk of, if you see the English, at risk of, like this, if you see, I know you people have been learning Qbanks, so you know these things. At risk of is a potential problem. Okay. Sometimes they are friendly with you. They use the word has a potential of. That one there, you know they're okay. But sometimes they will change the grammar and make it what? At risk of. If they say at risk of, it means it has a potential. But if they use the word with, it means it's an actual problem. Yeah. Okay. Yes. Then, so he has a cardiovascular problem. Cardiovascular problem, the A problem. He also has the actual problem. Sudden tearing chest pain. Okay. New left, new. That makes it an acute. So this guy has so many problems. If I see these three alone, I will not waste my time. I'll go and analyze the four because I've seen that this guy is having serious problems. Though I don't know the answer, but I'm using my Amasa. Okay. Yes, if you use the Amasa and you know a little bit of physiology, you are done. Priority, you get 100 over 100. Okay. Now let's go to D. A patient with stable, this stable alone I saw here, it makes this D, I will cancel it sharp because this one has what? An acute problem, sudden tearing, instability, unstable patient. Okay, and let me see. Okay, unequal radial pulses and new left weakness. So now I have B and C. I have B and C to analyze. Let me take them one by one. A patient with atrial fibrillation, he has ABCD cardiovascular. So the B has what? A problem. He has what? They have used the English word weight. So the weight is an actual problem. So another A. Okay. Then heart rate of 138. This is a stable condition. Know your vital signs. No, this is an unstable condition. 138. It makes the patient unstable. So another A problem. Okay. Then a blood pressure of 124/72. Okay. He has one stable and one unstable. So he has one stable and one unstable, okay, or unstable. So I'll write the two down. This guy has all these problems. Now let's go here. See, a patient with sudden, a patient with, so he too has what? An actual problem. Sudden tearing chest pain. He has ABCD problem, cardiovascular. Okay, yes, so cardiovascular, good. Sudden tearing chest pain, new left weakness, new, so it makes it acute. Okay, new left weakness and an unequal pulses, that makes him also what? Unstable. Okay, but let's look at the difference. The B and the C will confuse you, but look at it. The B had what? One stable vital signs, blood pressure. Okay, so this blood pressure alone makes me prioritize what? Because at least I can tell him to wait a little. Do your blood pressure, you are not stable, but your blood pressure is a little bit stable. It's okay. So I will tell you to wait. This Amasa is a game of who has plenty problems. Okay. Among the plenty problems, whose own is stable, whose own is unstable, whose own is actual, who is at risk of. So if I come and I see, example, I see a patient with what? They give me two patients. One patient is at risk of, and one patient is, so they will say a patient at risk of diabetes. Okay. Yes. And a patient with diabetes. The same two patients, the same medical condition, but I'll prioritize the B over this. Why? Because if I go to my AMASA, actual will be higher than potential. That is it. Yes. This guy has a big problem that if he was in the ICU, we will put what? Either amiodarone or all these drips, ICU drips on them. Okay. But what disqualified sorry, what disqualified the AFib guy is that yes, they are having tachycardia, AFib, RVR, okay, but their blood pressure is stable. This one has a sudden tearing. Assuming I don't know anything about sudden tear, I don't have any clue. Let me use only AMASA. I'm done. Okay, I'm done, guys. So this is it. I'm not going to waste your time here. So the question number 5, the answer is surely what? See, you will see it this way. NCLEX will show you this way. They will confuse you. They will add systems, plenty systems, like typical example like these ones. Plenty systems. So you have to sit down and analyze them one by one and take the answer out. If you use the master, you know how to use it well. I bet you 100 over 100, because we have tested the master on this page and it has never failed us before. Okay. Yes, this is, you will not find it in any book. I did it for myself. No teacher in this world has even heard of a master before. So, yeah, if you want to help people, God will give you ideas to help people. That is it. Okay, question 6. A patient with suspected acute coronary syndrome has an oxygen saturation of 97 degrees percent on room air and no respiratory distress. Which action is most appropriate? Comparative superlative questions. Okay, understand the trick. Shoot. Question 6. Shoot. 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 I'll get time for that master for you guys, especially the ATT boys. Okay, let's make time. Some 3 hours we do a master. Take it one by one. Then we solve plenty questions from it. Okay. Question 6. Acute coronary syndrome has an oxygen sat of 97. Oh, this question there, you should not even spend 30 seconds on it. Suspected. Okay. It's a synonym for what? It's a potential. There's a potential condition. Okay. Suspected, not with, of a patient with suspected acute coronary syndrome has an oxygen sat 97. Yes. So Paul. Oh, I'm also Paul. Yeah, so the ATT admin will organize a class. I think we have to kill it quick because people are writing so soon. Okay. Yeah. My aim is to see you holding the license, whether you got it from my page or you got it from someone's page. Once you hold the license, we are all happy. We will drink beer and and make party for you. Okay. Yes. So apply O2, withhold oxygen. While, so which one is most appropriate? Okay. So if we were going by book robotic nursing, Yes, if you go book, oh, patient with coronary syndrome, they will say apply this, do this, but clinical judgment. Okay. Yes. So definitely B stands out because oxygen status stable, no respiratory distress observed. Okay. Yes. So the B stands out for question 6. Question 7. A patient with suspected myocardial infarction reports that the pain has completely resolved after nitroglycerin. Which conclusion by the nurse is most appropriate? Question number 7. Shoot. Yes. 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 Stanley. Good. With suspected myocardial infarction. Suspected myocardial infarction reports that the patient has completely resolved. The pain has completely resolved after NTG. Okay, NTG. Good. If you are ambulance personnel and you go to the patients like, oh, I was having chest pain. Yes, I called you. But I have nitroglycerin. After taking it, I'm fine. I'm fine. Oh, are you sure? I'm fine. Okay. Then ambulance personnel say, "Oh, if you are fine, then we are going home. No problem. We are going." Okay. Ambulance personnel will say, "Oh, you are fine, but we still have to take you to the doctor." Well, which is which, right? So please partake. We are more than 70 on the page, guys. Everybody should partake. I'm looking at your answers. So if I see any odd one, then I address it. Okay. Good. Yes, so everybody understands this question. So diagnostic evaluation must continue despite the pain relief. Okay. Right. Question number 8. A patient experiencing an inferior wall MI develops sinus bradycardia at 42 per minute. Blood pressure is 78 over 48, and the patient is confused. Which intervention should the nurse anticipate first? This is at pie question. Every question we know where to put it to. Add pie. Add pie. The nursing process. And they took the intervention aspect and they have given you a question on that. Okay. So the add pie question. Which intervention should, when English says should, the compulsory verbs, you don't have to do anything else. Okay, it is a must. When the court says I will take you to prison, we should take you to prison. It's by force you have to go to prison. So which intervention should the nurse anticipate first? Yes, question number 8. Anterior wall MI. Okay, I mentioned this question yesterday. Wow. Yes, if you don't learn, you can't. So those of you who jump on Qbank and be learning it every day, no physiology, no, you pass the question, but you can't explain. Yes, you need it. You need it. Okay. Okay, so we have two answers for question 8. Okay. So let's analyze the question and see which of the answers were right. We've got answers to people, some chose A, some chose B. Okay. A patient experiencing an inferior MI, inferior wall, lead 2, lead 3, and AVF, develops sinus bradycardia at 42. They have even given you the answer. Guys, 42. I told you that bradycardia, sinus bradycardia is not an emergency until the patient start exhibiting signs and symptoms of what? The bradycardia. So they start becoming unstable. So how will you know that a patient is unstable? You look at the system by system or the vital signs. And the question was so friendly with us. They started with vital signs. So vital signs, blood pressure. This is a clear example of an unstable vital sign. So if I see this alone, if I was answering this question, if I see this alone, I will just jump and go and listen, read the instruction. Okay, anticipate first, atropine. Don't synchronize this patient. Sinus bradycardia. Those who choose A. VTAC, ventricular tachycardia. That we synchronize. Okay, good. So, and the patient is confused. Confused means they took, you see NCLES, they took the central nervous system and they give you an example of a confused or an unstable central nervous system signs and symptoms, confusion one, and they give you vital sign. So if you know how to connect them, you should be able to go. Okay, question 9. A patient with acute, I'm asking a question, chest pain has ST segment depression and has an elevated troponin level. Okay, which diagnosis is most consistent with this disease? Okay, so this question is coming from Qs, and you can use a master, but this is not a priority question. So they want diagnosis, recognizing cues and analyzing cues. So let me help you to recognize the cues. Answer your question, no answer, but I'm just making it simple for you a bit. So recognizing cues. This is acute chest pain. One cue. 2, ST segment depression. That is second cue. 3, elevated troponin O or troponin level. Okay. So combine these cues. That is recognition of the cue. Now analyze the cue. You analyze the cue to diagnose the patient. Then after analyzing cue, you prioritize hypothesis. Okay. If you want to be a doctor, this is how the doctors they click. So this question was so friendly. They did not give us lab results. They did not give us any vital signs, just the signs and symptoms, patient complaints, okay, and the EKG, and the troponin. So give me the answer sharp. Okay, so question 9, we have two answers. Troponin elevation. Troponin elevation. Recognizing cues, analyzing cues. Okay, good. Are we done with your answers? Can I present? Okay. So troponin elevation. Okay. Good. So we have acute chest pain, ST depression. ST depression is not a sign of ischemia. So when we look at the coronary syndromes, acute coronary syndrome, all the depressions are what? Either angina or what? Or end-STEMI. And what did I tell you about the difference? If you want to catch the difference, angina, for angina, always the troponin is normal. But for end-STEMI, the troponin will be elevated. So those of you who chose B, unstable angina, okay, the answer is C. Okay, the answer is C. Note it, you were able to identify the cues, but you were not able to analyze the cues. That is where a lot of people have problems. Analysis of cues. Okay, and if your physiology is not strong, cue analysis will be very difficult for you. And now, whether you like it or not, it is part of NCLES. So you can't judge physiology. Okay. 10. A patient with suspected STEMI, potential question, has a history of hemorrhagic shock. A history of hemorrhagic shock. Okay. So this is an S-bar question. The hospital cannot provide immediate PCI. Yes, because maybe it's a district hospital, a village hospital. Okay. Which action is most appropriate? PCI is percutaneous coronary intervention or cath lab. Okay. Your hospital does not have a cath lab, but the patient has come with what? Suspected STEMI. And he has a history of hemorrhagic stroke. Okay, with action, nursing action is most appropriate. Shoot. Question 10. I've explained the question for you. Hey. Okay, so question 10, everybody knows the answer now. Arrange urgent transfer. Okay, yes. Hey, somebody said A. Okay, administer fibrinolytic therapy. You can't do that for these patients. You can't give heparin for this history. You don't know what is going on. So please, it's good. You said the wrong answer. Okay. So someone has a suspected the background. He has a situation in the background history of stroke, a hemorrhagic stroke. Okay. So the answer was the immediate transfer. Let's shoot number 11. Somebody is saying, but how do you know it's STEMI? We don't know, but we are suspecting. Suspected STEMI. Happy, do you understand? How do you know it is STEMI? It has not been confirmed yet. We are suspecting. Okay, thank you. So don't read meaning into the question. Use physiology to answer the question. That's it. Otherwise, you get it wrong. Okay. Which patient statement represents the most significant immediate cardiovascular risk requiring additional assessment? Which patient statement represents the most significant immediate cardiovascular risk requiring additional assessment? Shoot. So, question 10, the answer was B. Arrange immediate transfer for PCI. Number 11, shoot. Oh, okay, happy. I didn't pay attention. Okay, cool. Number 11, shoot. Is the most significant. Jesus. Most plus significant. Yee. Most significant cardiovascular risk requiring additional assessment. Most significant cardiovascular assessment requiring immediate. Please explain again. Oh, which one, Mary? Which one should I explain again? Which patient statement represents the most significant immediate cardiovascular risk requiring additional assessment? Yes. So question number 11, we have two answers. Some are saying A, some are saying B. So far, we've not had anybody who says C or D. Okay, right. Some are saying A, some are saying B. Okay. My father experienced a myocardial infarction at age 78. Okay, is a risk factor. I occasionally use cocaine when attending parties. Okay, so let me show you this trick. All the answers, these two answers, they are right. But when you are stuck, do it this way. Okay, this is you. I think I was showing one of you guys this trick. This is you. You are the focal point. You are number one. Okay, then your immediate family is here. Then maybe your extended family will come. Then maybe social or environment, or let's say friends and all those stuffs are here. Okay. So if we come and we take risk factors of every condition, we check for what the severity, which one can affect you first. Okay, that's why they use the most significant immediate cardiovascular risk. Yes. So that is you. You are taking what? Cocaine. When attending parties, you are drinking the alcohol. Okay. So tomorrow, when you come and complain that you have hypertensive crisis, you have MI, you have this, and you list, we ask you all the risk factors questions, and we list them down. The one who is taking cocaine occasionally, he has been taking it, nobody is forcing it on him. And it is not the father. Listen, he said, I occasionally take it. So in the circle, in that circle, okay, you are this B is occurring in the nucleus of the circle or the focal point. Okay, yes. Let's say you are having unprotected sex. Okay, then you get HIV and you go to hospital. Then you go and say that, oh, My father had HIV when he was 78 years. Okay. Yes, that is a family link. The fact that there's a family link, we now analyze, is that a nuclear family or extended family? So nuclear family comes after you. So those are the people that you share genetics with, serious genetics, that whatever they are doing, it can also affect you. But what you are doing, you yourself, you are doing, affect you more than, we have people on this page that their fathers and their mothers are having hypertension. Yes, it put them at risk, but how can they get it? If my father has hypertension and I always exercise, I check my blood, I check my heart rate, and make sure I don't get it, will I get it? No, though I have the higher risk. I have the risk, but I'm checking myself well. You understand? Yeah, that is why the B stood up. Yes. So I mean, I know it's not shocking that people choose A, but this is the explanation. Get it? Okay. Good. 12. The nurse prepares to administer aspirin to a patient with suspected acute coronary syndrome. Which finding requires clarification before administration? This one, the Coco answer. Everybody should get it right. Okay. Everybody should get it right. Yes. So, number 12, shoot your answers. We are not going past the 3 hours. Whatever we get to on the 3 hours, we stop. I give the rest to you. Go and learn it. Oh, okay. Mary, when we are done, I will explain the question 8 for you, okay? I'll explain it again for you. Don't worry. Question number 12. Shoot your answers. Guys, I'm waiting for you. Don't be tired. Don't be tired. Shoot your answers. Let's go. Shoot your answers. Shoot your answers. And make sure you like the page, you subscribe. If you have not done it, like it and subscribe. Yes, keep your answer. Keep number 11. I will explain for you, okay, when we are done with everything. So, number 11 and number 8, I will explain it for you. Oh, I will sing of your goodness. Yes. Keep your answers. Yes. Your goodness is running after. Which finding requires clarification before administration? Aspirin. So the patient took one nitroglycerin tablet before arrival. B says the patient has an active GI bleeding. Okay, hemorrhage. Then C says the patient reports a history of controlled hypertension. And D says the patient's initial troponin was negative. So B stands out. Okay, number 12. Aspirin. Good. 13. The patient develops severe dyspnea, crackles, and pink frothy sputum. Blood pressure is 202 over 112. Which intervention is the priority? Good. The patient develops severe dyspnea, crackles, and pink frothy sputum. Blood pressure is 202 over 112. Which intervention is the priority? 13. Shoot. This is an art pie question. Yeah. Number 13. Shoot. Don't be tired, though. Don't be tired, though. That's why I train you every day to stay online for 3 hours. Because NCLEX will give you 5 hours. Each question in NCLEX is 2 minutes. So 300 minutes for 150 questions. Okay, so let me see question 13. 13. Good. So blood pressure is high. Pink froth is pulmonary embolism, these two. Okay, crackles in the chest, dyspnea. Position and you throw oxygen on the patient. So this one everybody knows the answer. Okay. Right. 14. A patient with acute pulmonary edema receives IV furosemide. Which finding best indicates that the medication is producing the desired immediate effect? Thank you, Tommy. Yes. Question number 14. 14. Yes. Let's shoot. Question number 14. Test yourself. We've got a lot of people. Oh, Ellen. Ellen says she will not be tired. Yes, question number 14. 14. 14. 14. 14. 14. Medication. Which findings indicates that the medication is producing the desired effect? A patient has pulmonary edema. Okay. Received IV lasis. Seriously, Ellen has made me laugh. Right. So yes, everybody is. Let me see if somebody had any other answer. No. Okay. So definitely increase urine output with reduce work of breathing. Okay. Good. Number 15. The patient with acute MI becomes restless and confused. The skin is clammy, cool, blood pressure of 76 over 42, and urine output is 10 in a space of 1 hour. Which complication should the nurse suspect? Ah, this is Q question. When you see it, you see it. Which diagnosis, which complication, which one this? So they have given you the cues. You should be able to identify the cues, analyze the cues. Aha. So this is analysis of cues question. Analyze the Q. Okay. A patient with MI. There is restlessness, there is confusion, that is CNS. Integumentary, there is cold skin, clammy. Okay. It can also fall under what? Cardiovascular with addition of what? Blood pressure low. Okay. And urine output. Genitourinary. Combine them. Give me the complication. Analyze the Q. Okay. So we have identified the Qs. So analyze the Qs. Yes. Analyze the Qs. Yeah. Right. Wow. Pfizer. Pfizer it is well. Yes. I know you can make it. You can do it. I trust you. Trust you, girl. Trust you, girl. Okay, so we've got two answers. Some people are choosing neurogenic shock. Some two are saying cardiogenic shock, maybe because they saw the restlessness and confusion. Okay, this is a clear example of cardio pump issue, cardiogenic shock. Okay, yes, so that is 15. It's not A. Okay, 16, 1 6. The nurse is caring for a patient with cardiogenic shock and diffuse pulmonary crackles, diffused, spreading all over. Okay, which prescription should the nurse question? We saw this yesterday. Hey. Well, my guys, Ayariga, number 16, shoot. Where is Victor? Number 16, shoot. If you don't get it right, I'll kill you. 16. Some people are waiting for people to send their answers, so then it will guide them. Shoot. I'm interested in you sending your answer. Okay, good. Shoot, 16, shoot. Diffuse crackles. Oh, Forrester. Forrester is laughing at me. Oh, wow. Forrester, what have I done to you? Yes, so question number 16. We have two answers again. Okay. Yes, so we have two answers. Some are saying C, some two are saying D. Okay, good. So C says rapid administration of several liters of crystalloids. Okay, and this is preparation for urgent coronary revascularization. Is the coronary artery blocked or is it torn? Okay, so these are the things you should know. Okay, Joanna, are you saying B? Vasoactive medication titration. Okay. A patient is caring for a client with cardiogenic shock. The heart cannot pump. Okay. And diffuse crackles all over. Which prescription should the nurse? There are a lot of fluids. When you hear crackles in the chest, there are a lot of fluids. Okay. And cardiogenic shock. So this is the explanation. This is the heart. And this is the lungs. The heart, I'm connecting them with the blood vessel. Okay. The heart has pumped blood here. Okay, another blood vessel to bring the blood back. Okay. The pulmonary veins. Okay, good. The heart has pumped the blood here. So we have 1,000 ml of fluid here. When it was time for the heart to pump the blood back to the heart stopped working. So the water here has become stagnant. Okay, it is not moving. You understand the question now? Okay. So what can or you've seen that the doctor has prescribed a certain order. Then you, the nurse, knowing physiology very well, what are you going to tell the doctor? Okay. So you saw that rapid, the doctor has prescribed that we should give IV fluid several liters in a very fast manner. You are going to cause more pulmonary edema because already the question here is saying what? Pulmonary crackles. Okay, this is a big Q. So C stand out. Okay, yes. You do coronary revascularization when the heart to heart blood vessels, heart to heart blood vessels get blocked, or let's say there is a torn, you go and repair it, or you go and remove this clot. That is what we call what? Coronary revascularization. Okay. Yeah, so the C stood out. Number 17, a patient with large anterior wall MI. Wow, large. Suddenly develops severe dyspnea, hypotension, and a new loud holosystolic murmur. Let me add it. They have hidden the keyword. Okay. A new loud holosystolic murmur. This is a very tricky question. Open your eyes for it. Which complication is most concerning? Good. Most concerning. Shoot. Oh, sorry, John. Sorry. Sorry. The word several and only. It confuses you, eh? Happy. Oh, yeah, it's a red flags. Okay. What about the diffuse? What is diffusion? Diffusion is the movement of particles from one region to another. So the crackles are spreading. Okay, Mary, the crackles are spreading. They are diffusing. They are moving from, okay, diffuse. So when the patient breathes in or out, you don't hear the crackles at one point. Okay, it's spread. Breathing out, it spreads. So we call it diffuse crackles. Number 17, shoot your answers. Which complication is most concerning? Okay. Okay, so everybody's choosing A. Yeah. The papillary muscles or the septal rupture, anterior wall, MI. Okay, cool. 17B. A, sorry. 17A. 18. A patient becomes hypotensive and tachycardic after a cardiac procedure. The nurse observes jugular venous distension and muffled heart sounds. Which action is the priority? Wow. A patient becomes hypotensive and tachycardic after a cardiac procedure. The nurse observes jugular vein distension and muffled heart sound. Trouble has come. Which action is the priority? Okay, question number 18. Shoot. Question 17 was A, not D. Okay. So take notes, those of you who chose different answers. So people have seen the cues and they already know the analysis of it. They already know the diagnosis. Yes, people have seen the cues and they are relating. Oh, the Beck's triad. I love it. Yes, Rosemary. Right. So you prepare for this is a classical condition of cardiac tamponade. Okay. Yeah. So you go and drain the fluid. Okay. You drain muffled heart sounds and those stuffs. Okay. You drain the fluid B. 19. Which assessment cluster is most consistent with cardiac tamponade? Assessment cluster is most consistent with cardiac tamponade. These people think they are smart. They have changed it. This is a change of English. If you understand this word, you know the answer already. Hey, English, if you don't know, you don't know. Computer will cut at 85 and sack you from the room and fail you. Knowledge is power, indeed. Knowledge is power. Knowledge is power. Knowledge is. You see the way they've changed the English for you. If they write which assessment is classical, you will know the answer. So which assessment cluster? Okay. Oh my God. Yes, Rosemary. Yes. 19. Good. Okay, so this is they are asking what they are basically asking is what are the signs and symptoms or which assessment findings will tell you that this patient is having what Beck's triad. Oh yeah. So there is hypotension, distension, jugular vein, and muffled have some B. Okay, good. B. Yes, you can't go back after answering the question. Yes, that's it to English. If you skip, you can go back home. I don't know if nowadays they've changed it. 20. A patient with blunt chest trauma has worsening hypotension, ING. Okay. Jugular venous distension and a clear breath sounds bilaterally. Which condition should the nurse suspect? So, Tommy, you see our question some. They have given you a cue. Analyze the cue and give us the diagnosis. Okay, this is a cue question. A patient with blunt chest trauma has worsening ing, continuous verb, hypotension, jugular vein distension, and clear breath sounds. Combine all these cues and tell me your diagnosis. Yes, Miss Everest, are you there? My life is in your hands. So. Oh, Joanne. Joanne said, come and carry me to Canada. Yes, question number 20, 20, 20, 20, 20. Okay, let me see. I'm getting different answers. Wow. I'm getting different answers for question 20. Okay. It seems though people didn't understand the question. Okay. 20, 20. Yes. 20. Okay. Good. Yes. So we had two answers. Okay. Some said A, some said B. So let's analyze. A patient has a blunt chest trauma. I know why people choose the A because of this. Has worsening hypotension, jugular vein distension. Okay, yes. Tension pneumothorax, you can get it from this. You can get it, it can lead to hypotension. Cardiac tamponade, it can get it from this. Okay. Yes, the trauma can also cause issues, can cause injury to the heart. Okay. And the fluid will move from the heart cells to the pericardial space. To take note. Has worsening hypotension. Yes, you can also get it for cardiac tamponade. Okay, let's analyze it. Then you ask yourself, tension pneumothorax, this is the differential diagnosis. Okay, are you going to get distended jugular vein? Yes or no? Cardiac tamponade, are you going to get distended jugular vein? Yes or no? Okay, then they give you one good answer. In clear breath sounds bilaterally, tension pneumothorax, are you going to get a clear or absent breath sounds? Cardiac tamponade, are you going to get this or not? So even at this point, you should know your answer. Okay. Yes. So cardiac tamponade B. I know when people saw the chest trauma, they started picking A. Okay. There was no sign of collapsed lungs. Okay. So that one they brought it there to kill you. 21. A post-operative patient suddenly develops dyspnea, pleuritic chest pain, tachycardia, and oxygen saturation of 84. Which action should the nurse take first? Cool. 21, shoot. Which action should the nurse take first? Okay. 21. Yes, so let me see. Hey, Victor, you are answering 22 already. Okay, okay. 21. Good, 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 good. See you for catfish. Eh, yes. Good. Yes, so everybody had it right. Okay. You support oxygenation and activate the rapid response or emergency response. Okay. Which finding in a patient with pulmonary embolism most strongly suggests hemodynamic instability? Which finding in a patient with pulmonary embolism strongly suggests hemodynamic instability? Shoot, 22. 22, shoot. If you join, then you like today's session. Like it, today's session, like it, click on the like. If you haven't subscribed, please subscribe and hit on the notification bell so that anytime we go live, you will get a notification on your phone or your device. 22. Let me know my answers. 22. 22. 22. Yes. Let me know my answers. 22. Okay. Hemodynamic instability. Okay, heart rate is high, normal blood pressure, there is pleural pain, oxygen sat 95, unilateral calf swelling with mild tenderness. So C, definitely. So this one is like everybody, okay, knows the answer. 23. We have 23. So we have 1 hour more to live. Okay. The nurse suspects a lower extremity deep vein thrombosis. Which action should be avoided? 23. Shoot. 1 hour to live. The nurse suspects a lower extremity deep vein thrombosis. Which action should be avoided? Shoot. 23. Shoot. Pa, 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 pa. 23, shoot. Which action should be avoided? Okay. Avoided. Shoot. Should be avoided. Okay. So, massaging the extremity to improve venous return. The thrombus can dislodge and travel and cause stroke and pulmonary embolism. So never do that. Somebody chose this. Okay. But somebody chose A, but I think maybe it was a mistake. Okay. Right. Okay. 24. Which combination creates the greatest immediate concern for pulmonary embolism? Which cluster or which combination or which signs and symptoms, okay, yes, creates the greatest immediate concern for pulmonary embolism? Shoot. 24. 24, shoot. Yeah. Mhm. 24. Shoot. I trust you. I know you can do it. I trust you. Ooh, yeah. Pulmonary embolism. 24. 24. 24. 24. Okay. So we got two answers. Some people said peripheral neuropathy. Really? Bilateral foot numbness and oxygen, normal oxygenation. Okay. Then we have a majority also choose the A, recent optopnic surgery, sudden dyspnea, and tachycardia. Yes, so the A is one. Okay. Yeah, they don't have peripheral neuropathy in pulmonary embolism. Okay. Then 25, a patient with suspected massive pulmonary embolism is hypotensive and severely hypoxemic. Which intervention should the nurse anticipate? A patient with suspected massive pulmonary embolism is hypotensive and severely hypoxemic. Which intervention should the nurse anticipate? Okay, shoot. 25, shoot. I'm watching your answers. 25. Yes. 25. Which intervention should the nurse anticipate? Anticipation. Anticipate. I trust you. I'm admiring your answers. Yes. 25. 25. 25. 25. 25. 25. Yes, so some chose D. We got two answers. So some said delaying therapy until D-dimer results becomes available. Then the majority also chose anticoagulation with possible thrombolysis or thrombectomy. Okay, yes. So the B ones got it. In this, a pulmonary embolism with these presentations, don't wait for your D-dimer. Go for this. Okay, good. A patient reports abrupt abdominal and back pain, abrupt, becomes hypotensive and has a pulsatile abdominal mass. Which action is most appropriate? I love this question. And has. The answer is here. A pulsatile abdominal mass on your palpations. Oh, abdominal scans. Which action most appropriate? Let's go. 26. I trust you. Yay. I know you as a father. I know you as a friend. I trust you guys. I trust you. You can do it, man. We are winning together. Trust the process, girls. Guys, trust the process. Our life you have been so, so good. Every breath that I have made. Which action is most appropriate? 26. Okay. So 26, everybody got it right. Okay. Prepare for the patient for immediate OP, OR intervention, operation, OR intervention. Okay. 27. A patient with acute aortic dissection receives IV beta blocker. What is the primary purpose of this treatment? Yay! Let's go. 27. Shoot. 27. Shoot. Yes. Yes. A. Aortic abdominal or abdominal aortic aneurysm or dissection. Let's go. 27. Yeah. 27. Sorry, 27. Shoot. 27. Shoot. The primary purpose of a beta blocker. You are good. I trust you. You are the best. I trust you. You are the best. Trust you. You are the best. Trust you. 27. Trust you. Okay. Yeah, so beta blockers reduce the heart rate and force exerted against the aortic walls. Okay. Yes, so that is it. B is correct. 28. A patient with suspected aortic dissection remains severely hypotensive after receiving an IV beta blocker. Which intervention should the nurse anticipate next? Suspected aortic dissection remains severely hypotensive after receiving IV beta blocker. Okay. Which intervention should the nurse anticipate next? Anticipate next. This is the key word. Aortic dissection. I've given you beta blocker. Fat. So what should we do next? Oh, my soul. She really see you never before. Oh. Hey, 28. Hey, let me laugh at you for 28. It's one of the tricky questions. Hey, let me clap for you. I'm admiring people's answers. Yes, you got plenty answers on 28. Yeah. Okay. So you know the reason why it's good to learn physiology and not to die on Qbanks. Aortic dissection medications. Somebody's aorta inner lining is tearing. Okay. You are suspecting that. Blood pressure is crazily up. You went to give beta blocker. The beta blocker has failed. Blood pressure is still high. What is the next thing you will do? Good. Yay. Oh, I'm blessing the Lord, oh my soul. I'm watching your answers. Plenty answers. Somebody even wrote only 28, no answer attached. Um, okay, so let's analyze it. So I explained the question to you. We have given beta blockers, and always they give beta blockers, okay, before they give other antihypertensive medications. Okay, why? Because the beta blocker, they work on both the heart rate and the pressure the blood exerts on the walls of the arteries, especially the aorta. Okay, so our focus is to reduce the pressure. Good. On the walls. and also bring the blood pressure down. Okay. Now you gave it and it failed. What is the next thing you do? Okay. There is still pressure inside the blood. There's still pressure inside the blood. So what do you have to do? Some people were choosing D. Some people were choosing C. Some people were choosing A. Okay. So A says add a prescribed IV vasodilator. Okay. So the vasodilators will help it to open the blood vessel and let the blood pressure drop nicely. The Philippine and hydralazine. Okay, good. Now, those who choose C, administer a fibrinolytic. That one is out. D, as a lot of people also chose B for boy. Discontinue the beta blocker and administer a stimulant. It will increase the heart rate, reflex tachycardia. It will put pressure on the walls of the aortas. That is going to be dangerous for this guy. So we're not going to do that. Okay. Then D, rapidly infuse blood until we don't have any issues with blood here. Okay. So the answer is A. 28. The answer is A. Okay. Yes. When I casted my nest on 28, I caught a lot of people. Okay. You discontinue medications when patients start having what reactions. There's no reaction here. Okay. 29. Which finding in acute aortic dissection indicates possible organ malperfusion? 29. Wow. Please, can you explain the C? I'll explain to you, okay? The C. Okay, the C, the C. Administer a fibrinolytic to restore aortic blood flow. This is aortic dissection. So if you, I don't know if you understand the concept, or let me get it. This is the aorta, this is the heart. That's the heart. And this is the aorta. It's coming out. Okay, that's the aorta. Okay. As the blood is going, a certain part of the aorta, the inner lining, is torn. So blood is pocketing outside or is like pushing here. So this place is torn. Like this. This hole is here. And blood is entering here. Okay. If you want to control complications, you have two things to do. Reduce the blood pressure of the blood inside here. Okay. So that is one. Reduce it. Secondary, reduce the pressure of, blood pressure is in two ways. The pressure of the blood here and also on the walls of the arteries or the containing vessels. Okay, so you reduce the pressure on the walls. So in aortic dissection, doctors always give what? The beta blockers first, because the beta blocker will come and reduce the pressure on the wall and at the same time reduce the what? The blood pressure and also work on the heart rates. Okay, yes. If you give hydralazine, that is a vasodilator. Hydralazine. Hydralazine is only coming to open the blood vessel like this, big. They will open it big like this, vasodilator. When it does that, you will increase the heart rate because the heart will not be happy. So the heart rate will increase, and the heart rate increasing means there's going to be some minor pressures on what? On the walls. Yes, inside the blood vessel, blood pressure has dropped, but on the blood walls, the pressure is still there. So people will first give the beta blockers to serve for the foundation, the base, then they give. When it fails, then you give this. Don't give the reverse. Okay. Already this place is torn. We are bleeding, so we don't need a heparin, fibrinolytic. We need more fibrin and this one here to come and stop the bleeding. We don't have to destroy the fibrin by giving heparin. Okay, yeah, that is why the 28 was the A. Okay, yes. Okay, let's look at 29. Which finding in acute aortic dissection indicates possible organ more perfusion? You have changed English here, so shine your eyes. Which finding in acute aortic dissection indicates possible organ more perfusion? 29, shoot. I did this for you yesterday. I connected the heart to different organs in the body. So tell me your answer for 29. 29. Don't be tired, though. Shoot and let's go. Okay, 29, 29, 29. Good. Yes, so new oliguria, okay, renal hypoperfusion accompanied with increased creatinine. Okay, cool. 30. The nurse assessing, so 29, all of you had it right. Okay, no new answer. 30. The nurse assesses a patient with sudden severe leg pain. The extremity is pale, cold, numb, and pulseless. Which action is most appropriate? I read again. The nurse assesses a patient with sudden severe leg pain. The extremity is pale, cold, numb, and pulseless. Which action is most appropriate? Shoot. Let me see. I will keep quiet on this question and see the answers that will come. Yes, 30. Shoot. 'Everybody should contribute. Everybody should contribute, okay? Contribute. Yes. Everybody should contribute. Yes. Everyone should contribute. Contribute. Everyone should contribute. Good. So far, so good. Everybody has got it right. So notify the vascular team and prepare for urgent revascularization. Okay. 30 is C. 31. Okay. 31. Good. Which finding indicates that acute arterial ischemia may be progressing toward irreversible injury? Which finding indicates that acute arterial ischemia may be progressing toward irreversible injury? Shoot, 31. I'm waiting to catch you. Yes, Charlie. Okay, 31. Arterial ischemia may be progressing toward irreversible damage. Okay, 31, 31, 31, 31. Good. 31 to all of you had it right. So new paralysis and profound sensory loss. New paralysis and profound sensory loss. Okay. Right. 32. A patient develops a regular marrow complex tachycardia at 190 beats per minute. Blood pressure is 68 over 38, and the patient reports severe chest pressure. Which intervention is the priority? I read again. A patient develops a regular narrow complex tachycardia at 190. Blood pressure is 68 over 38, and the patient reports severe chest pain. Which intervention is the priority? Shoot. 32. Shoot. Please, it is not clear. Really? What is not clear? Siaba. What is not clear? Shoot. 32. Shoot. Mhm. 32. Severe chest pain. Okay. Heart rate. Severe chest pressure. 32. 32. 32. 32. Let me look through your answers. Well, people are giving yes. Yes. 32. Shoot. 32. Shoot. 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 So 32, we've got three answers. We've got B, C, and D. B, C, and D. B, C, and D. This is tachycardia with what? And this is tachycardia with severe chest pain. Okay, patient is unstable. So B, prepare for synchronized. Okay. C, administer oral beta blocker therapy and reassess in 1 hour. Hey, bye. Prepare for unsynchronized defibrillation despite the presence of a pulse. No, we do synchronized cardioversion. Okay. Synchronize. You should give the shock on the rate. See, our problem is on the R. Okay. Yes. So if you the distance, you see the V-tax like this. Okay. You give the shock here in the R. Okay. The R. And it's what we call synchronized cardioversion. Okay. Good. So with that, so let's continue. 33. A patient has a regular We have 30 minutes more to close, okay? And we have 27 questions. No, 17 questions to go, 50 today. A patient has a regular narrow complex tachycardia at 180 per minute, but remains alert with pulse pressure, blood pressure of 126 and no chest discomfort. Which intervention should the nurse anticipate initially? Okay, 33. I read again. A patient has a regular narrow complex tachycardia at what? 180, but remains alert with blood pressure of 126 and no chest discomfort. Which intervention should the nurse anticipate initially? 33. Shoot. 33. Shoot. Patient is stable. Remember. Okay. Our only problem with the patient is what? The heart rate. Patient is alert. Blood pressure is fine. Patient is not complaining of anything. Chest discomfort is no the chest discomfort. What will you do as a nurse? Should the nurse anticipate initially? Yes, 33. Mm, 33. Okay. Oh, let me go up for you. So D is not showing. Okay, it is showing now. Caleb. Okay, 33, 33, 33, 33, 33, 33. Oh, okay, then I got you now. So Caleb, bring your answer and let me submit. You can see your D now. I'm giving you pressure. Yes, Caleb, I'm waiting for you. Shoot your answer. Now you can see your D. Okay. Right. So yeah, vagal maneuvers. Okay. Vagal maneuvers. Okay. Oh, you don't understand the B. Yes. So when a patient has increased tachycardia and the patient is stable, you start with your vagal maneuvers. The vagus nerve, stimulate it. Where does the vagus nerve pass? It's a wandering nerve. It passes through the body in so many areas. Okay. Yes. The ears, on the neck, vagal massage. Okay. Somebody can tickle you in the armpit. Those places that somebody can pass their hands and you easily sleep in this world. You know your body now. So those are the places, okay, you easily sleep. Then they can give you a pressured object for you to blow against. Like say we give you a syringe, then we turn and give you the tip of the syringe, not the needle, the syringe that blow. You blow so that the plunger will pull out. Okay. Yes. So those things are there. Okay. Yes. So we call it vegan. If it doesn't work, then we give what the adenosine. If patient begins to show any sign of instability, then we do what? Synchronized cardioversion. Okay, cool. Right. 34. A patient with AFib has a ventricular rate of 148. Which finding most strongly support immediate synchronized cardioversion? Shoot. This is a cheap question. You should know the answer. Those who work in ICU, you should know the answer for this. Sharp. 34. Let's go. 34. Shoot. 34. Shoot. 34. Shoot. AFib with a ventricular rate of what? 148. Okay. We call this diagnosis AFib RVR, atrial fibrillation with rapid ventricular rate. Okay. So this is an abnormal rate. No human being on earth should have this heart rate. Okay, 148. Unless maybe you are a baby or whatever. But like adult like us, okay, this rate is not good. Which finding most strongly support immediate synchronized cardioversion? I'm watching your answers. Immediate synchronized. Okay. What will you see? That will make you tell the doctor, please, let's immediately cardiovert this patient. Which of these findings? 34. 34. Wow. $34. Wow. Understand the question now. 34. Okay, so let's analyze. People chose A, some also chose C. Okay, so let's analyze. They have given you the clue, okay, that the patient has what? An actual problem of atrial fibrillation. Ventricular rate is 148. That is superly high. Okay, but sometimes we keep eyes. If the patient is stable, okay, if the patient is not having anything, we just keep monitoring the patient. Cool. But it says that which findings most strongly support immediate cardioversion. So what will you see? What will the patient do or exhibit among these four guys that you will tell the doctor that, oh, let us synchronize this patient? Okay. So let's take it one by one. Those who choose A, okay, you are saying that you will tell the doctor to cardiovert the patient when the patient's heart rhythm, this AFib, okay, the rhythm, we are talking about rhythm, not the rate. The rhythm has been present for an unknown period. Yes, see, we have patients who have chronic AFib. They are living with it. You sit in car with them, you go to the swimming pool, you do everything. Even on this page, let us take us to the EKG. Let us do, we will still see human beings with chronic AFib. Like somebody has chronic hypertension. We have chronic AFib. Okay. Yes. So somebody who has chronic AFib and he is eating at the chop bar, will you go and catch him that let's go and I'll go and cardiovert you? It won't work. Okay. So A is totally out. Sometimes they change the grammar to confuse you. A patient reports and the C guys, B is totally out. This one is out. So the C, the patient develops on top of these two problems, he develops another problem of hypotension and acute pulmonary edema that makes them unstable. Okay, once they become unstable, we need to what? Synchronize cardioversion. Take note too, when you hear this word, look for instability. When you hear synchronized cardioversion, look for instability. And I've told you how to look for instability. Check all the body systems. You start from the head to the toe. Check bodies. You know the body system. Learn Mr. Rec. So cardiovascular, respiration, okay, all the abnormal presentations. Then when you finish with the body system, you come to vital signs. Ask yourself, vital signs. Patient is having high temperature, high pulse, low, very low pulse, having this. Okay, yes, perfusion, saturation is dropping. All these ones. So this one stands out. Those who chose the C. I know a lot of people did not understand the question 34. That is why. Okay, good. Let's go on. Let's go on. The monitor shows a wide complex. Okay, radium of 220. A wide complex. You should know this one. The patient is unresponsive and has no pulse. Which action is the priority? I explained this yesterday. You have connected the patient to the monitor. You are only seeing a wide QRS complex, very wide. Okay. And it is showing you a rate of what? 220. The machine is showing you, not you that you check it with your hands or a Doppler. The patient is unresponsive and has no pulse. You should know the condition already. Which action is the priority? I've explained to you. Answer it. Let's go. 35. Good. Good. Stanley. Very good. You've got the diagnosis. So answer. Give me the answer. You see how one cardiovascular system see the different questions you are getting from it. Good. Good. 35. Good. Hey. Wow. Okay. 35. Okay. So all of you did well. Some people chose C. I don't know why, what influenced them. Okay. So we got answers between the B and the C. Some people said, okay, I've connected my patient to the monitor like this, connected to the monitor. This monitor is giving me, this is the normal QRS. So like this. Okay. But instead, this monitor is giving me this QRS is giving me this. Okay. Like this, a wide QRS. Okay. Then it's giving me a wide QRS. Like this. This is my isoelectric line. So I am seeing electrical activities that bumps above the ISO, the zero line. Okay. And the machine is telling me a heart rate of what? 220. So I am seeing an electrical activity. Okay. But the question says that what? The patient is unresponsive, one. And two, you check the pulse. You did all your carotid pulse. All this one. You are even lucky you have a machine, the Doppler. You check the femoral pulse, the pedal pulse, done every pulse you want to check. There is no pulse. Okay, this is a cardiac arrest sign. Okay, but what type of reading? This is a pulseless electrical activity. I am seeing electrical activity, but no pulse. PEA. Okay. Sometimes you can even see a normal P wave QRS. Okay. The fact that the machine is showing you a normal EKG does not mean the patient should have a pulse. You should check it. That is why you have hands. Check the pulse. So if you see electrical activity, and you don't see any pulse, it is a pulseless electrical activity. Yes. So we know the algorithm now. You continue your CPR and deliver what? A synchronized, because I can't see any R here. Okay. To deliver a shock here. So I'll deliver the shock anywhere I want. I can deliver it here. 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 Yes. That is why we say unsynchronized defibrillation. You understand? Okay. So the B people had it. 36. Let's go. A patient is unresponsive and pulseless. The monitor shows an organized electrical rhythm at 70 per minute. Which intervention is appropriate? Shoot. Let's be fast. A patient is unresponsive and pulseless. The monitor shows an organized electrical activity. This. Which intervention is appropriate? You see, your machine is giving you a nice heart rate, 70. The nurse, you are sitting at the nurse's station, you are seeing a nice heart rate, 70. You are happy. You are not doing hourly checks. In the morning, when you go and see the patient will be dead with rigor mortis setting in. Okay, so definitely everybody got the answer right. You understood 36. 37, the the cardiac monitor displays a flat line in one lead. Okay. Which action should the nurse take before concluding that the patient is in asystole? Before you conclude that the patient is having asystole, what should you do? 37. Shoot. I have EKG leads plenty. Okay. If you want to even use the machine, you get 12 leads. If you want to use the normal continuous monitor, we have 3 leads. Lead 1, lead 3. We have 5 leads. Okay. One of the lead is showing flat line. What should you do before you confirm that or more? Because on the monitor, you select which lead should display after you connect the patient to the monitor. Tele, you will select manually, like the way we change channels on television. You select that I want lead 1 to display, I want lead 2 to display, but 5 leads are taking pictures of whatever is going on. But the one you selected that it should display is showing ACES2. So what will you do first? Okay. 37. So let me see if we got any. Good. So all of you had. So you verify leads. You verify, change it on the monitor. Now, why is it that lead 1 is not coming? Let me change it and see. Okay, change to lead 2. Lead 2 to the same. Lead 3 the same. Oh, okay. And confirm the rhythm in another lead. So you verify. Sometimes the patient has even removed this thing. 38. A patient develops symptomatic bradycardia. Atropine is ineffective and the patient remains hypotensive and confused. Which intervention should the nurse anticipate next? Should. 38. Okay, follow. You do EKG, don't worry. NCLEX does not give higher EKG. So Charlie, 38. Shoot, let's go. 38, 38, 38, 38, 38, 38, 38. Symptomatic bradycardia. You have given atropine fat. It's ineffective. And the patient is still hypotensive, now getting confused. Worship you. 38. 38. Wow. I need more answers. Shoot. I am giving atropine. It's not working. Hey, Mr. Josephine, I'll kill you. Sarah, should we think? Is it advisable to synchronize bradycardia? Hey, Charlie, Africa. Oh, God. Okay, so let's take it. We've got so many answers. Some are saying A, some are saying B, some are saying C. Okay, so it means the understanding is not there. Let's read and analyze the question. A patient develops symptom bradycardia. Okay, good. So he has bradycardia, but now started showing signs that, oh, yes. We have given atropine, but the atropine is not effective. And the patient is still hot, hypotensive. That is the same thing they were talking about. and what? Confusion. Central nervous system depression. Okay. Cardiovascular system is crashing. Good. Heart rate is low. Okay. Which intervention should the nurse anticipate next? Okay. So some say A, some say B, some say C. You don't have to synchronize bradycardia, so this is out. Vagal stimulation. Already this patient is crashing, blood pressure is crashing. Are you going to still do vagal stimulations? I told you we do vagus nerve stimulation to let the patient even sleep more. Okay. So those who chose B is not the answer. So vagal stimulation is out. Transcutaneous English. Oh. Okay. Transcutaneous. This is like a patch, a sticky patch. Have you seen the? Put it on their chest. You stick it on their chest. It will help the heart to pump, and the heart rate will go high. This is a temporal pacer. Eh? You stick it transcutaneous patch. So we do that, then later they go and do the permanent pacer. They go and insert the pacer either in the SA node or whatever inside. Okay, this is a temporal patch that is placed, stuck on your chest. This was a bonus question for you, but still people got it wrong. 39. Let's shoot. Which patient requires unsynchronized defib? Unsynchronized. So you should understand this question. They have changed the grammar. Okay, let's go. Which patient requires unsynchronized? Okay, is it and the siblings? Who are the siblings? Prince. I like that phrase. Oh, Sarah, it was a bonus. Oh. Transcutaneous pace. When you go to hospital, if you work in the ER, go and ask for them to show you transcutaneous pacer. Question 39. I'm waiting for my answers. Shoot. Okay. Okay. So they are just simply asking for the shockable rhythms. Okay. So ventricular fibrillation with no pulse. C. Those of you who chose C. A patient with sinus bradycardia. Hey, those of you who chose D. You see, you did not understand the question. So yeah, this is a shockable rhythm. They intentionally change this English because when they ask you what is shockable rhythms, you get the answer. Okay. Yes. 40. Our time is up. We have only 10 questions to finish. Do you want us to stop or we should finish the 10 questions? What do you think? Because I don't want to take your time. Our 3 hours is our 3 hours. So let me know from the chat box if you want us to continue or to stop. Then I give you the slide. Maybe at home you try and do the last 10 questions yourself. Let's finish. Okay, cool. Right. Okay, let's finish. It's only 10 questions. But let's answer fast. I beg you, so that we finish. Okay. Yeah, it's only 10 questions. Question number 40. Okay. During resuscitation, the patient remains in pulseless electrical activity. Which potentially reversible condition should the nurse consider? Potentially reversible condition should the nurse. So question 40 should understand the question. Question 40 should. Yes. Question 40 should. Yee. Oh, let's be fast. Yes, shoot. Shoot. Yes. Understand the question, but shoot. I'm waiting for your answer. So, yes. Oh, I'm waiting for the answer. So, yes. Okay. 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 So, what they are looking for are the H and the T's. Okay. H and the T's. So, the cardiac tamponade, guys. Okay. Yes. Stable hypertension is not part. Okay. It's not part. The answer is A. Okay. 41. The nurse evaluate 4 patients with elevated blood pressure. Which patient is experiencing a hypertensive emergency? 41. Shoot, we did it yesterday. Which patient is experiencing a hypertensive emergency? Shoot. 41. Shoot. 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 Okay, cool. Yes, so a clear, obvious sign, high with acute pulmonary edema. Okay, this one without symptoms, no. Anxiety that results with rest, no. One missing one dose, no. So C stands out. Okay, so 42. Why should blood pressure generally be reduced carefully during a hypertensive emergency? 42. Why should blood pressure generally be reduced carefully during a hypertensive emergency? 42. Yes, shoot. 42. 42, shoot. Yes. I'm waiting for your answer. So, 42, 42. The last time questions are challenging us. Let me laugh. Yes. Yes. So, yes. Okay. So, why should we reduce blood pressure gently? In the body, we have what we call auto-regulation. Okay. So, if your heart blood pressure is so high, and the auto-regulation was created and implanted in us by God, that it will help you to adjust and readjust our blood pressures and make sure that our physiology, okay, yes, goes with that regulation. So if your blood pressure is low, and it is always low, your auto regulation will make sure that the body organs and everything will adjust to that over time, so that you will not have any symptoms of hypotension or these ones. No. Yes, and the same for higher. So imagine somebody who always have a higher blood pressure for years. They are always having higher blood pressure. Their auto regulation has adjusted their organs to that level. So you, when they come to your hospital and you think, oh, your book said that blood pressure is high, so we should give hydralazine or beta blockers to shoot it down. You crash it down. You cause what? Ischemia. Emergency ischemia. And when you get ischemia, the kidneys, the brain, the lungs, they will be in big trouble. Okay. So you should rapid can decrease perfusion to organs or ischemia, accustomed to higher pressures. Yes. So all of you should know your normal blood pressure. It's very important. We are nurses. You should check it and know your normal, so that no healthcare worker will go and kill you. Okay. 43. A patient reports severe chest pain after using cocaine. Which mechanism most directly increases the risk of myocardial ischemia? Okay. Cocaine, oh, cocaine. You should know the physiology of cocaine when it enters your body. So let's go. Which mechanism, which physiology most directly increases the risk of myocardial ischemia for somebody who uses cocaine? Especially those who smuggle cocaine, they swallow it. If you are not lucky and it bursts in your stomach, you are in big trouble. You will die within seconds. Yes. So physiology, those people don't know the physiology of cocaine. That's why if you follow the money aspect, you die early. 43. 43. Yes. 43. Yes. 43. Good. Yes. So cocaine causes systemic vasoconstriction. That's it. And it will cause, the muscles that lines the blood vessels, it will cause it to shift like somebody having convulsion. Okay, vasospasms, or seizures. We call it vasospasms and systemic vasoconstriction. Your blood pressure will be shooting. The cardiac muscles, imagine the arteries, the aorta will squeeze like this. So the heart muscles cannot get enough blood and they begin to die. If you smuggle cocaine and it bursts, you are in big trouble. Okay. Which patient should the triage nurse classify at the highest acuity? Acuity shoot. 44. higher acuity. I'm looking at your answer. Shoot. Mm, 44. Shoot. Shoot. Answer someone. Shoot. 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 Yes. Shoot. 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 Good. Shoot. Shoot. Yes. So a patient with resolved chest discomfort and stable vital signs. Okay. So between A and B, a patient with cold, pulselessness, blah blah blah. Okay, so A is out. It's B. Between C and D, a patient with chronic bilateral edema, chronic, okay, bilateral edema and no respiratory distress. Okay, D, a patient with controlled atrial fibrillation requesting a medication refilled, no chronic and controlled, no requesting a refill. Okay, I'll go for this. So between B and C, a patient with cold, pulseless leg. Okay, B. The answer is B. So you do it quick. So the answer is B. 45, SATA, select order, apply. If you get one wrong, minus one. So which findings support suspected acute aortic dissections? Shoot your answer. 45. This is a SATA question. Which findings support suspected aortic dissection? Mm-hmm. 45. 'Hey, wahala come. Okay, so let's see. Findings of acute aortic dissection. Okay, so there is abrupt pain that is maximal at onset. Okay, good. So you choose this. A significant blood pressure different between arms, no two ways. A new focal neurological deficit. Okay, so neurovascular deficit. Cool. Symmetrical, both places, both symmetrical pulses with pain reducible by palpation. It's not true. It's not true. New aortic regurgitation murmur. We call it the holosystolic murmur. Good. and progressive organ more perfusion. So I think only this one was out. The rest are right. You mark yourself. Okay, cool. 746. 4 questions more, then we leave. Which actions are appropriate when acute coronary syndrome is suspected? Which actions are appropriate when acute coronary syndrome is suspected? Actions. Shoot. 46. Shoot. At least 45. I thank God nobody chose D. So it means you guys, you are good. I have to stop teaching because you can easily pass in class. Yes. Which findings are appropriate when acute coronary syndrome? Which actions? You are suspecting somebody with coronary artery syndrome. What actions do you think you will do? You will do. So choose it. Sata 46. Mm-hmm. 46. Shoot your answers, yes. Okay, so let's see. What will you do when you suspect? I told you let's do the ABCDs if you don't know what to do. So obtain 12 lead EKG. 12 lead EKG, yes, every human being would do. Administer chewable aspirin when not contraindicated. Cool. Delay cardiac biomarkers until the patient becomes severe. So they are saying delay troponin. Don't do troponin now. This is a wrong answer. Assess fluorescent PDE5 inhibitor, sildenafil, tenofovir, sildenafil, before giving what? Nitroglycerin. True. Apply oxygen routinely, regardless of saturation or respiratory condition, is wrong. You don't give oxygen anyhow. Establish IV access, yes, and initiate cardiac monitoring. So it's A, B, D, E. Mark yourself. A, B, D, E. Mark yourself. 46. Okay, good. Let's continue. 47. The same SATA. Which findings indicate that tachydysrhythmia is causing hemodynamic instability? Tachydysrhythmia is causing. Okay, when somebody gets tachydysrhythmia, tachyarrhythmias, tachydysrhythmias. Yes. A, B, D, F. No E. Yes, it's true. Ellen. A, B, D, F for the previous question. 47. Please shoot your answers. Yes. Yes. Sarah, you are true. 47. Last 3 questions. Shoot. And let's go. You've really done well, guys. You have resilience. That is perfect. A, B, D, E, F. What is 7? Okay, so let's go through. Tachyarrhythmias is causing hemodynamic instability. Okay, so hypotension is one. Altered mental status instability is one. Ischemic chest discomfort. Ischemic chest discomfort. Yes, it can affect the loads. Acute heart failure. It can retain fluid. Yes. Palpitations with otherwise normal perfusion. It's wrong. Normal perfusion made it wrong. Signs of shock. Cool. So A, B, C, D, F. A, B, C, F. Joanna has dodged it. Okay. A, B, C. So E is out. 48. Saturday. Why there's plenty of this? 48. Select all that apply. Which interventions are appropriate for a patient with acute pulmonary edema? Oh, this is a cheap question. You get it fast and go. Which interventions are appropriate for a patient with acute pulmonary edema? Somebody has gotten acute emergency pulmonary edema. What interventions will you do for them that is appropriate? 48. Shoot. A to F. What will you do? Severe pulmonary edema. They've brought this person to your hospital. What will you do? 48. Yes, Genevieve. Give me your answers for 48. Yes, 48. Yes. Let me read. Oh, 48. You know the answer by now. Me, I'm done with the answers. Yes. Okay, so let's go through acute pulmonary edema, fluid in the chest. Okay, good. So position the patient upright when tolerated. Cool. Support oxygen and ventilation. Very important. There's the B. Administer prescribed diuretics. Yes, you administer, then you monitor intake and output. So monitor renal function, electrolyte. Okay, that is also part. Place the patient flat. No, it's out. This alone will make me not read the answer again. Reassess breath sounds and work of breathing frequently is important. So A, B, C, D, F. A, B, C, D, F. A lot of people had all right. Last but one question, 49. The nurse is screening a patient for contraindications or precautions before administering nitroglycerin. Which finding requires further evaluation? Screening for contraindications or precautions. Which findings require further education? Shoot. require further evaluations. Require further evaluation. 49. 49. Yes. Which findings require further evaluation? You want to give or you want to, yes, administer. You want to give nitroglycerin. What has the patient done? I said, no, I will not give you first. Let me further reevaluate you before I give you. Because you have done this, you have done that, you have done this, you have this, you have this. Okay. That's what the question says. Okay. Kukululu. Tu, 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 tu. Okay. Let's look at it. Let's see. Okay. Most people have answered it. Right. So, a patient is saying he has used tadalafil recently. Yes, we will stop. We will not give you medication. We will we evaluate you further before we give. Patient is having significant hypotension. Yes, it's very important because this is a potent vasodilator. Then patient is what suspected right ventricular infarction. Right ventricular infarction. Okay. So you have hypertension if you should give this medication. So we are not going to give severe aortic stenosis. Okay, blood is out into the aorta. The aorta has closed. Okay, no. Seasonal allergic rhinitis treated with intranasal medication. No. So this is out. Recent sildenafil use. Perfect. So it's like only the E is out. Only the E is out. These are cheap distance. So 50, last question for the day. 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 Okay, I'm coming. Let me squeeze it. Okay. Four patients arrive simultaneously. Which sequence reflects the most appropriate order of assessment? Four patients. You are the charge nurse. You have four patients at your bay. Four rooms. Room one, room two, room three, room four. You want to do assessment for all these four. How will you start? Which room will you go first? From there, go to which room? From there, you go to what room? Because you must do this after taking over so that you know what to do. Yes, shoot. Click it this soldier. Let me also answer it. Patient is starting to okay. Okay. This is a repeated question. Somebody's oxygen saturation is 82. Crackles. Think through. Mhm. 50. Eh? Wow. Okay. Okay. Let's see. Four patients arrived simultaneously. Which sequence reflects the most appropriate order of assessment? Okay. Order of assessment. So this patient with sudden tearing chest pain, unequal pulses, and new confusion. Okay. This is a clear situation of what? Cardiovascular issues. C. So on the ABCD algorithm, this is a C. Cardio. A patient with oxygen saturation of 82. Wow. Crackles, meaning fluid in the lungs. And think frothy sputum. This is pulmonary edema. Okay. This is a breathing problem. B. Okay. So a patient with stable atrial fibrillation stability, heart rate is not higher than sitting on the borders and no symptoms. Okay, this is cardiovascular stability. A patient with chronic exertional angina relieved by rest. This has a problem. This is a breathing problem, but he has some kind of a little stability there. Okay, so if I want to prioritize using my Amasa. Okay. Amasa says A will come first before all these guys. And on the A, if you take only the A algorithm is the A, B, airway, breathing, circulation, this. Okay, so let's take the airway with instability is what? We don't have any airway with any instab. Okay, this is crackles, as in the lungs. So this is a breathing problem. Okay, this is breathing B. So we've got breathing here and we've got breathing here, but this one is unstable. Okay, so two. Then let's go to, so we will put this one down. Let's go to C, cardio. This is a cardio problem, this is a cardio problem, but this one is unstable, so one will come. Okay. Right, let's go and analyze the stable guys, the 3 and 4. Okay, breathing, who is stable, and cardio, who is stable. I will do 4 before 3. Do we have 2, 1, 4, 3, 1, 2, 4, 3, 2, 1, 3, 4, 2, 1, 4, 3? You can't hide. Go and master this. Go and master it, guys. Go and master it. It will help you a lot for the rest of your life. Okay. Yes, Amasa. If you don't know Amasa, this question you get it wrong. Go and master it too. Me, I play with it because I knew Amasa long time, so many years. So yes, initially it will be very difficult, but when you grab it, when you get the concept, that's it. You smile over all conditions. That comes with priority and selection. Okay, guys, thank you so much for today. You did your best. Okay, so tomorrow morning I'm starting, and my 8 days off is over. So I'm starting night today, and I'm going for night to Wednesday morning, 6 nights straight. And I'll finish Wednesday morning. Then I have another 8 days off. So let's pray to God for good strength, safety, survival. We meet again. Okay. So the morning sessions, and Aaron Olubumi is there, so she will be taking care of that. But for the afternoon, if I'm not around, Ayariga is there to do. Okay. If I'm not around, Ayariga will be there to solve it. So we have shared the job. The page will never be empty. Okay. The RNs are there. They will solve, they will help you go through everything. So, I mean, God bless you all. Let's keep believing and let's keep trusting the process. You know, I'll post the slide. Yes, I'll post it. Yes, all the answers are here and their rationales. Okay, all the answers and their rationales. Okay, yeah, so the ones you had wrong. But before you look at the answers, when you get the slide, you to sit down. It's only 50 questions. Sit down and answer it again. Answer it again. Okay. Please, if you have not liked today's page, like it before we go. Today's session, go and hit on the like button. Okay. Hit on the like button. Yes. Let's like it. So when you do these things, Facebook or YouTube will connect us to a lot of people, and yeah, we will get a lot of people to watch us. Yeah. So yes. Oh, JDV, you joined late. Okay. Sorry. If you have not subscribed, please subscribe to today's channel. Subscribe, and hit on the like button. If you have not liked it, hit on the like button. Okay, hit on it sharp. Hit on the like button. Okay, that's my number. In case you are new here, and 975 3. Okay, cool. So hit on the like button. This is my number, my WhatsApp line. So if you want us to chat on anything, you can pick it and chat me. But not today. I'm going to sleep. It is 2:41 here. And by 6:30, I must be on my way. So I have only 4 hours to sleep for night shift, for 12 hours night. We meet God willing tomorrow. Okay. God bless you all. Bye bye. Please like and share. Like and share.